Kwe Madalotio, Indelusia, Samo, Libra Deni, Esizoni. My name is Chief Libra Deni. I'm from Esizoni First Nation. And it's an honor to be here today to ask some questions.
And hello, I'm Valerie Gideon. I'm Senior Assistant Deputy Minister responsible for health at Indigenous Services Canada, and I'm Mi'kmaq from the Kizk'pegag First Nation.
Okay, Valerie, thank you for this video call. We just want to ask a few questions regards, just have a quick conversation regards to the COVID-19 pandemic. And as you know, many of our communities are affected by, the world globally is affected by it. But as a community of Eskizoni and many Mi'kmaq communities in Nova Scotia, we are in the process of preparing but one of the things the people ask our leadership these questions, right? So it's good to have a Mi'kmaq person working from your office to assist us, and I want to thank you for that, Valerie. Been assisting us every day on phone calls to make sure that nobody goes hungry, and the equipment that we need, and for future, like after this virus passes by, there's going to be a lot of damage and we'll need lots of healing. And I want to thank you for being there for us. But we have a couple questions I want to ask you.
Of course.
Okay, first question that I want to ask you. How about for those individuals who have been treated with TB, tuberculosis, in the past, or have latent TB? Are those individuals considered high risk as well? And what are some potential extra precautions we need to put in place for that?
So COVID-19 is still new, and so we don't have a lot of definitive research with respect to the links between tuberculosis and COVID-19, but certainly we would advise individuals that have tuberculosis to take extra precautionary measures, or if have had tuberculosis. Anyone that has had any type of respiratory illness would be considered at higher risk for complications of COVID-19. So those individuals should really limit their exposure to group settings, to multiple individuals, and stay at home as much as possible. Also would practice good public health measures, so the hand washing, the not touching your face, cleaning of surfaces on a very regular basis. So things that communities can do for those individuals is really ensure that if they need support to clean their home on a regular basis, if they need food delivered to their home instead of them going out to do the shopping on their own. If they typically would use public transportation, that they don't do that, and that they stay home as much as possible. That's really the clear recommendation.
Okay. All right. Self-isolation. I have a question in regards to that. In relation to self-isolation, for those who have been traveled outside the country and are now in self-isolation or isolation, our community members are looking for more clarity around the protocols around self-isolation versus self-monitoring for family members who have not traveled and are living in the same household, and also those who are in contact with them. Can you tell me the difference?
Yeah, so absolutely. So, I think that if you had close contact with your family members and you get a call from a public health unit to say you may have been in contact or you were in contact with someone who either tested positive for COVID-19 or it's presumed that the individual has COVID-19, and you've been living in your household with other relatives, then the public health advice will likely be isolate at home with your relatives with whom you were in contact with on a regular basis. It's kind of like in for a penny, in for a pound a bit. But if you did not have close contact with your family members, you've just recently returned from travel, and you can self-isolate alone as an individual by finding another space, that would be recommended so that you're not exposing your close family members to the possibility of COVID-19. So that would be a bit of a differentiation. But there are guidelines on the coronavirus site of the Public Health Agency of Canada for specific individuals in different situations with respect to what would be recommended for self-isolation.
Okay, thank you, Olali. In regards to people who have no symptoms of COVID-19 and who have traveled, what do you recommend for them to ensure best safety practices for those who flying from somewhere or been to a place where possibly they're infected? So what can you tell us? What are the best safety practices for that?
Well, I think the recommendation is that if you've traveled internationally and you return to Canada, you should self-isolate for 14 days. If you've traveled within Canada, you're not required to do that. But some provinces, though, like for instance in the province of Quebec, they recommend that all individuals above the age of 70 should be self-isolating. So you really have to look at each of the provincial governments, and they are, issuing guidelines on a very regular basis. So what would have been recommended yesterday is not necessarily what will be recommended today or tomorrow. So very important for people to access information regularly and follow the public health advice, because the situation in the province will change and the guidelines will change according to what is happening within that particular province. So certainly international travel, you should be self-isolating. But in terms of if you traveled from Toronto or you traveled from Montreal or somewhere else, you really need to look at what's being recommended within the context of your province.
Okay, what's your opinion? And I know many parents and are wondering about this next question, and we can't answer this question for them. So what's your opinion for Easter preparation for a community that has many children? What would be the best opinion, best advice you can give us?
Well, I think right now most provinces have closed the schools and daycare environments. I would certainly advise communities to consider not having group situations for kids in terms of Aboriginal Head Start or play in close contact with each other. So not have play dates, right, where children are going over to other people's homes and doing a lot of interaction. But for sure, a family has siblings, has 3 or 4 or whatever children, you don't want to separate the children from each other. I think the risks at that point when you're living in the same house, everybody is just together and siblings are playing with each other, and that's fine. You want to ensure that you're not exposing your kids too much by going outside the house in public settings unless it's absolutely necessary, and you're washing your hands very regularly. As soon as you come back into the house, you're washing your hands very thoroughly. You're regularly cleaning surfaces in your house. So maybe you clean the house once every 2 weeks or once every week. Maybe you do it twice a week, right? We don't know yet how long COVID-19 might live on particular surfaces. So there's recommendation to do extra infection prevention and control, and that includes in your house. So that would be the advice at the moment. So you're not isolating small siblings from each other. Not that you would ever try to be successful in doing that anyway. And it's important for families to feel like they remain connected to each other. Children will go a bit stir crazy in a house. So trying to keep them, well by having good, solid play, activities, reading, all sorts of different things like that. Very important for morale, right? Because you also don't want people to start getting depressed. It's not easy to be able to be in that situation for weeks at a time. Everybody's routine is disrupted. So just fostering on that really important connection between parents and their kids and siblings together.
Okay, even like grocery stores and let's say the stuff coming from the stores, should they be cleaned up or disinfected for safety precaution? Even getting grocery bags or whatever. How would you advise for that?
That's a good question. I don't think we've had any specific public health guidance around that. I think minimizing the number of people in the family that are going out to grocery stores shopping, and not going to the grocery store every day, but like going and getting your essentials. You don't have to stockpile for 3 weeks, but just getting your essentials for the week, coming home, washing your hands. I really can't comment on the bags issue because we don't know how long it would live in a surface. But if you have the ability to sort of wash your grocery bags after you've used them, I mean, that's an extra precaution that you can take. That's actually not that much work to do.
Okay, what are some DIY sanitation techniques that will be effective for killing the virus?
There are actually some good videos online about how to do household cleaning, and some good practices that we can certainly send to communities, in addition to the hand washing videos and other public service announcements that we've done. So I'm happy to be able to share those over with you.
Okay, so 20 seconds or more, or hand sanitizers. I know people are complaining, their hands are getting, like, not a rash, but it's just too much cleaning, right? What would you recommend, hand sanitizer versus soap? Like, what's the difference?
Well, I mean, I think soap and water is absolutely fine. And alcohol-based sanitizers, if you do not have access to soap and water. So, you went out to the grocery store, you're coming back into your car, you want to clean your hands with alcohol-based hand sanitizer before you touch the steering wheel, as an example. But there's no need to overuse it, and there's no need to do both, right? So you can do soap and water. If people are getting very dried hands, use hand creams, after you've washed your hands. That's something that you can do to try to minimize the impacts of that. And there are various soaps, right? You can use milder soaps as well. That'll be just as effective as more intense perfume-based soaps, for instance.
Okay, is also soap and water effective to clean your home as well? Like, and also which surfaces are best for cleaning cleaning with soap?
I'll have to follow up with you specifically on sort of what would be the priority products that people would recommend, and we can send you a guideline on that.
Okay, I have another question that many of our elders and those who are diabetic, and many community members that go dialysis, they're very nervous going to hospital at this time. What can you say to them from their home to going to dialysis for a hospital and back? And I know that at this time many other things are shutting down except for the hospital. What can you say to us to assure our elders and dialysis patients will be okay, and if it's safe?
I would say that there's a lot that the country has learned since SARS and since H1N1, and provincial hospitals are extra cautious with respect to infection prevention and control measures, and making sure that health providers are using personal protective equipment when they need to, and also self-screening so that they're not coming into a hospital setting potentially demonstrating symptoms, or if they've traveled. And the risk to an elder's health of not accessing services that they need is much higher than the risk that they face with respect to potentially having COVID-19, right? So we have to remember, dialysis is an essential service, and we have to trust that the health system is protecting those individuals, knowing that they're at greater risk. What we can do is make sure that they're not using group transportation. So instead of them going into a medical transportation van, use private taxis, right? The government will reimburse those costs. Use a private driver that has self-screened to make sure that they're not infectious, or have not been in contact with anyone that's infectious, haven't traveled. Like, those are safety measures that we can put in place for the elders so that they feel safe and secure. But they definitely should not hold back from accessing essential medical services, that if they don't have that, they will definitely get sick. while the odds of getting COVID-19 is still very, very low.
So should they wear for their comfort of their stress level, should they wear a mask and goggles or a gown, or would you recommend that for their comfort and safety?
No, it's not recommended unless they actually exhibit symptoms and they are worried about getting someone else sick. But in terms of protecting themselves, that is not necessary. Health providers will wear equipment if depending on the procedure, medical procedure that they'll be doing, if they feel that they will be exposed, right? And there is a lot of science behind this, a lot of really knowledgeable researchers that look at these things and develop those public health guidance.
Okay, last question about the COVID-19. Like, how dangerous is this? And what's the best way to protect yourself and your family?
So the risk to Canadians is still low, I think the infection prevention control measures around hand washing, not touching your face, limiting your exposure to group settings, staying at home as much as possible. Those are they're simple, but they are the best ways of protecting yourself and your family.
Okay. Well, and Valerie, thank you very much.
Thank you very much, Chief.